So, our topic of discussion is therapeutic drug monitoring. So, what is therapeutic drug monitoring? In blunt word, if you are giving some medicine to a patient, you are monitoring the therapeutic effect. What do you mean by that? Suppose there is a hypertensive patient, you are giving some antihypertensive medication. You follow up that patient after 15 days or 1 month and you check the BP. Suppose the BP was 190 by 140. It comes down to say 120 by 80. Was again a word. So that is you are measuring the outcome of some medications. Alright. Similarly, suppose you are giving some medication to a diabetic patient. So suppose the fasting sugar is, let's say, 300. You give some medication, you follow up after 1 month or 15 days and the fasting sugar comes down to suppose say 140. Alright. So you are monitoring the outcome of a medication, therapy by a medication. So these are all technically right. So these are all technically monitoring the therapeutic outcome of some medication. So what makes therapeutic drug monitoring? So it's an advanced level of monitoring of drug. Alright. So therapeutic drug monitoring is measurement of drug and their active metabolites in patients receiving medication for the purpose of optimizing their therapeutic effect while minimizing adverse effects. So first thing, measurement of drug and their active metabolite. Why do you need to measure active metabolite? Anyone? So there are certain drugs which are converted into its active metabolites, and its active metabolite produces therapeutic effect. Give me an example. Well, somewhat correct. The most common of them, Levodopa to dopamine. Right? Again, works. तो जगह नहीं है तो क्या देखो ना इन देखी plenty of new faces. Alright, for that purpose we need to, in that case we need to measure the active metabolite for the purpose of optimizing their therapeutic effect. So to produce maximum therapeutic effect and minimizing adverse effect. Now from your knowledge of pharmacokinetics and pharmacodynamics, you are aware that, that the effect of the drug is produced by the concentration of the drug in its plasma. Alright, plasma, better to say, at the site of action. Now you are not able to measure the concentration of the drug at the site of action, so it is taken for all practical purpose. It is taken in some certain cases. It may not be possible to detect things by clinical examination or by laboratory test. Suppose, for example, in case of hypertensive patient, we are checking the BP. as an outcome. For diabetic patient, we are checking the blood sugar or the HbA1c level for the outcome. But for certain cases, that may not be possible. Deepjita, where is it? So, close predictable relationship between dose, concentration and pharmacological effect. So, this is what you get from your study of general pharmacology, that pharmacological effect is produced by the concentration of the drug. Then ability to measure low concentration in biological samples. So, from your knowledge of biochemistry, you know the various methodology used for measuring concentration of various substances. Give an example. Anything? HPLC? Energy? রিয়া বাহ আকাশ থেকে পড়ছো হ্যাঁ হ্যাঁ so these are the methodology used. By this methodology it is we are able to detect even small samples, small specimen in biological samples. Alright, these have arrived. Where is this? ঘুমে গেছে? Better understanding of pharmacokinetics and pharmacodynamics. ঠিক আছে? How pharmacokinetics can affect the concentration of drug? অনন্য কিছু বলতে চাইছে। Absorption, distribution, metabolism, anything that affects such things may affect the concentration of drug. Customized drug therapy for individuals. What do you mean by customized drug therapy? Anyone? So, the imdad can go to a tailor and get his measurement and make a shirt, and that shirt will be exclusively specific for imdad. No other person can wear it. Or else you can go to a shop and you can find ready-made shirts, but that won't be specific for anybody. It will be a generalized sewn shirt. Alright, in this case, for now let's say you go to the pharmacist. There you find medicine which are generalized. Suppose a medicine ciprofloxacin 500 mg. So that is not customized. For things to be customized, your weight, your body composition, any failure of your organ like liver, kidney, that need to be taken into account. Now we have calculated doses in kidney failure. We have derived the formula for calculation of doses for renal failure. Now that has to be taken into account. Now what is available in the market is there. To naam ki? So that is what you mean by customized drug therapy for individual patient on measurement of drug concentration in blood or other body fluids. ঠিক আছে? And the last thing, safe and effective drug therapy for individual patients. So that is the objective of having therapeutic drug monitoring. So indications. What do you mean by indications? Amrita? Indication মানে কি? Huh? Anyone? Purpose of use. ঠিক আছে, এবারে পরীক্ষাতেও কেউ বলছিল ইন্ডিকেশন মানে জানি না। ঠিক আছে, ইন্ডিকেশন মিন্স পারপাস। So drug with narrow therapeutic index which are prone to produce toxicity. Example, lithium and digoxin, phenytoin আর দীপজিতা কিছু বলতে চাইছে, বল শেখ বল, ভুলে গেছি, ভুলে গেলে চলবে না। ঠিক আছে, so this drug has very narrow therapeutic index, so the concentration has to be maintained within a certain dose. The drugs like lithium, if it overshoot its concentration, it produces toxicity. If it goes below the concentration required, it would not produce desired effect. ঠিক আছে, তবে কি হয়, কার্বামাজিপিন না, phenytoin antiepileptic drug, so that too has very narrow range of safety. ঠিক আছে, if it dips below the concentration required, it would, বল phenytoin কিসের ইউজ হয়, পড়া হয়নি, অ্যান্টিএপিলেপটিক ড্রাগ। কবে পরীক্ষা কবে? সেপ্টেম্বরে। কদিন বাকি? 4-5 মাস। তার কবে পড়া হবে? So narrow therapeutic index, but you need to prevent whatever bipolar disorder or epileptic fit, whatever you need to prevent, so you need to maintain that concentration. ঠিক আছে, lithium is indication for therapeutic drug monitoring. Phenytoin is used in therapeutic drug monitoring. Digoxin is also used for therapeutic drug monitoring. ঠিক আছে, second, monitoring preventive therapy where there is no clinical or laboratory abnormality. Now, as Anushka has said, phenytoin is used for prevention of seizure. Alright, but for that prevention to occur, you have to maintain it within a certain range of plasma concentration. If it falls below that range, the medicine will become ineffective. ঠিক আছে, so for preventive therapy, বুঝছিস? আগে কোনোদিন এসেছিলি? আচ্ছা, anticipated variation in pharmacokinetic and pharmacodynamics. pharmacokinetic কোথায় deviation হয়? Anyone? Hey, বল। pharmacokinetic, hepatic failure, renal failure, there is deviation. ঠিক আছে, genetic, so some individual, some medication which lead to metabolism of some drug may be absent or may be in excess. ঠিক আছে, nutritional, there is something known as food drug interaction. There are certain substances or food that induce enzymes. Example, drug হলো, but food, anything. So there is this grapefruit, নাম শুনেছিস? grapefruit, বাতাবি লেবু। ঠিক আছে, so this has a property of induction of hepatic enzymes that leads to faster metabolism of drugs. So, nutritional and in malnourished patient, malnourished individual, the production of enzymes by the liver, chiefly albumin, may be low. What is the role of albumin in drugs? So, drugs bind to albumin. So, that may be hampered. So, which drug produces the pharmacodynamic effect? The free one or the bound one? Free one. The free drug that produces the pharmacodynamic effect. The bound one are inert. They are only act as reservoirs. Where the free drug is more. Suppose in both cases, in two patients, the concentration is equal. But in one patient, the concentration of free drug is more than that of bound one. Where the concentration is more of free drug, the activity of the medication will be more. Let's say phenytoin. Phenytoin in one patient, phenytoin is probably 80%, 80 to 90% it remains bound to protein. So, very few percent if the amount of free drug gets altered, the activity of phenytoin increases. Here, phenytoin ki kore? ADR? ADR of phenytoin? Phenytoin short note আছে জেনে নিবি major organ failure. So, in renal failure, there may be in CKD, suppose in CKD, the rate of excretion of drug may be low. So, by regular dosing, the concentration will increase, leading to কি নামটা অন্তরিপা কি করবে কনসেন্ট্রেশন বেড়ে গেলে কি হবে কনফার্মিং অ্যাডভার্স ড্রাগ ইন্টারঅ্যাকশন আচ্ছা আয়াট্রোজেনিক মিনিং না iatrogenic meaning some medical therapy that is causing it. Alright. Acha. Confirming adverse drug interaction which cannot be deduced clinically. ঠিক আছে? Certain drug interaction which may not be possible to detect clinically that can be detected by this therapeutic drug monitoring. Checking compliance, particularly in context of therapeutic failure. Now, there are certain psychiatric patients who would not take drug, but they will say that we are taking drug. In that case, you can go for a therapeutic monitoring that will show the level of drug in the plasma. So, checking for compliance. Indirect quality check for spurious medicine. What do you mean by spurious medicine? Spurious medicine? জালি মেডিসিন ঠিক আছে fake medicine. So, patient is saying that patient is taking medicine but you are finding no action, no therapeutic outcome. In that case, you can go for a therapeutic monitoring. By therapeutic monitoring, you won't find any concentration of drug in the plasma. ঠিক আছে? So these are the indications. Procedure: sample collected, usually serum, alright, serum or plasma, and there are other sample also collected, mostly serum or plasma by venipuncture. ঠিক আছে? Time of collection is জল কতবার জল খেতে হয়? So time of collection is when steady state is maintained. What do you mean by steady state? Or Antaripa. What do you mean by steady state? Anyone? Huh? বুঝতে পারছি না। না হলো না। হ্যাঁ, ঠিক আছে। Rate of administration of drug is equal to rate of elimination, where the transfer concentration remains the same. That is the steady state plasma concentration. When it is achieved, after 5 half-life. ঠিক আছে? So, in this curve, you can see that the plasma concentration is slowly rising till rate of elimination is equal to rate of administration. That is the steady state. তাহলে কোথায় নেওয়া হবে? There is a crest and there is a trough. কোথায় নেওয়া হবে? So if you are going for the adverse effect, you go for the crest. ঠিক আছে? Because in a narrow therapeutic window, if the concentration overshoots, there is ADR. And if you are going for the therapeutic effect, you go for the crest. ঠিক আছে? Because if the concentration dip below the therapeutic window, below the therapeutic range, then there will be no effect. ঠিক আছে? So for crest, to take 30 minutes prior to administration of the next dose. তাহলে steady state is achieved, then proper storage of sample, then there are various methods of storage out of preview of this class, then measurement of drug or metabolite by appropriate methodology. Alright, if methodology change, then concentration, reading of the concentration may also alter. Achha. Drug and metabolite, we have discussed why metabolite is being A, and total and free drug, to bollo total and free drug. Why do we measure the total drug and free drug? বল। হ্যাঁ, প্রোটিনের সাথে বাইন্ড আর ফ্রি দুটোই মেজার করা হয়, আর ফ্রি ড্রাগ ইজ দ্য অ্যামাউন্ট দ্যাট ইজ ফ্রি which is active. Analytical techniques: high performance liquid chromatography, also known as HPLC. বল কে বলবে HPLC? What is HPLC? সদ্য বায়োকেমিস্ট্রি পড়ে যারা এসছে, বল আদিত্য বল, হোয়াট ইজ এইচপিএলসি? এইচপিএলসি হাই পারফরম্যান্স লিকুইড ক্রোমাটোগ্রাফি, বল এনিওয়ান? হ্যাঁ বল। Now, what is the procedure? What is the procedure of HPLC? কি হলো সবে পড়ে এসছে বায়োকেমিস্ট্রি, রেডিও ইমিউনোঅ্যাসে, শর্ট নোট আছে তো? বায়োকেমিস্ট্রি শর্ট নোট আছে তো? আছে তো? নিজেই কনফিউজ। দেন এনজাইমলি ইমিউনো অ্যাবজর্বেন্ট আছে, ELISA। Anyone? Anything? বল, ও কিছু বলতে চাইছে, সে কিছু বলতে চাইছে। হ্যাঁ, মাইক্রোবায়োলজিতে না, এটা তো ইয়েতে পড়ানো হয়, বায়োকেমিস্ট্রিতে পড়ানো হয়। হ্যাঁ পড়াচ্ছে তো, বল কিছু একটা বল, কোনটা বলতে পারবি? হ্যাঁ হ্যাঁ বল, ওই ELISAটা বলতে চাইছি, বল। হ্যাঁ আরে হেপাটাইটিস সি, আমি প্রসিডিওরটার কথা জিজ্ঞাসা করছি, হোয়াট ইজ দ্য প্রসিডিওর? হ্যাঁ আস্তে, কি বলতে চাইছে? আচ্ছা, অ্যান্টিজেন কোটেড ওয়েলস, সিরাম, হ্যাঁ তারপর হ্যাঁ হোয়াট, নামটা কি জানো? হ্যাঁ Ishani, what Ishani has said about ELISA is somewhat correct. So there is this plate where antibody is being planted, to which target antigens act. Then another antibody which is labeled with something, maybe an enzyme or something else, or some radiological substance is added. So when they bind together, when a substrate is added, that lead to change in color or change in radioactivity, that is being measured either by calorimeter or by radioactive measurement, Geiger Müller counter, whatever be it. ঠিক আছে, একজন ELISA বলতে পেরেছে অ্যাটলিস্ট। তোর কি হলো রে জয়িতা? না। So HPLC, there is a mobile phase and a stationary phase. ঠিক আছে, so the sample is being forced into the stationary phase by a pump. এগুলো কেউ কিছু পড়েনি কোনোদিন? Being forced into the stationary phase by a pump. Now this stationary phase consists of adsorbent material. So various substances get absorbed at various level. Alright, and that can be detected by a spectrometry. Mass spectrometry, শুনেছে? Anyone? So that is detected by a spectrometer, mass spectrometry. Alright, so that's how we measure the concentration. RIA, radioimmunoassay. So radioimmuno substances are first added, then so antibody bound to radioimmuno substance, radiologically active substance are added, to which our substance of interest is added. So there is a competition between the radiologically tagged substance and the substance which we want to measure. So certain amount of radioactive material will be released, and that is being measured. Radioimmunoassay তো শর্ট নোট আছে রে বায়োকেমিস্ট্রিতে আছে না? এবিট ছেড়ে দাও তো হচ্ছে না। Then we come to the outcome of it. We know how to measure the concentration. So concentration measure করে করবোটা কি? So we have to customize the dose for the patient. Alright. তাহলে কি new dose হচ্ছে old dose into concentration of desired divided by concentration of measured dose. ঠিক আছে? So desired dose, so there are various literature available for desired dose. ঠিক আছে? It may not be same for all the person. So how it goes on? First, doctor identifies candidate for therapeutic drug monitoring. Which candidate? কোন candidate? Well, hepatic failure, renal failure, or anything? And nanotherapeutic drugs তো আছে, হ্যাঁ? Yes, and say it loudly, my dear. I can't hear you. You cannot find out the cause of failure, therapeutic failure, and এই মাত্র পড়েছি তো ভুলে গেল। So sample is collected and analyzed using appropriate method. Alright. So use appropriate method. Different methodology leads to detection of different level of drug in the plasma. So appropriate method has to be used. Result interpreted in light of clinical history. Now why is it important in light of clinical history? Anyone? Aditya? Why clinical history becomes important? No. So before you go for therapeutic drug monitoring, the clinical diagnosis has to be accurate. Now say for example a patient comes with depression. Name some antidepressant. Imipramine and amitriptyline. Both these drugs are candidate for therapeutic drug monitoring. What are the features of hypothyroidism? Anyone? Decreased metabolism. Goiter. Hypo বলছি কিন্তু। So hypothyroidism also comes with depression. Maybe. ঠিক আছে? Hypothyroidism also comes with depression. Also shows depression. Now, if you are treating a patient of hypothyroidism with as many drugs as possible, I mean antidepressant drug as possible, will there be any effect? Will there be any effect? You simply have to correct the level of thyroid in the body. That will lead to reversal of the depression. কি বলছিস? You simply have to correct the level of thyroid hormone in the body. That will lead to reversal of depression. So clinical diagnosis is very important. ঠিক আছে? Wrong clinical diagnosis cannot be treated by therapeutic drug monitoring. Then we go for dose modification. ঠিক আছে? These are customized dose for patient, individual patient, not the ready-made formulary that are available in pharmacy. So drug commonly subjected to therapeutic drug monitoring. কি কি আছে? So all the antiepileptic drug, Phenytoin, Phenobarbital, Carbamazepine, Valproate. So the problem with this antiepileptic drug is that you have to maintain this drug, the plasma concentration of this drug at certain level. If the level falls, then that will lead to seizure. ঠিক আছে? So the plasma concentration level has to be maintained. Then যেটা বলছিল amitriptyline, imipramine, ঠিক আছে, antidepressant. Then lithium is used in bipolar disorder. Lithium comes as a short note. Lithium and mechanism of action use comes as a short note. Learn lithium thoroughly. All the antiepileptic drug, Phenytoin, Phenobarbital, Carbamazepine, Valproate comes as short note. ঠিক আছে? Learn it very well. Cyclosporine use it's an immunosuppressant. It's an immunosuppressant. ঠিক আছে? What do you mean by immunosuppressant? Anushka? Suppresses the immunity. Acha, then vancomycin, antibiotic. ঠিক আছে? Gentamicin, amikacin, tobramycin. What type of antibiotic? না না আমি বলছি কি কেমিক্যাল নেচারটা কি? এনিওয়ান? The aminoglycoside antibiotics. ঠিক আছে? Acts against which type of bacteria? It's not a broad spectrum antibacterial. না, তাহলে তার একটা হবেই। ঠিক আছে? It acts against gram negative bacteria. ADR, adverse drug reaction. Anyone? These are nephrotoxic drug. Really? These are highly nephrotoxic drug and needs monitoring, especially for neonates. Then methotrexate. কি ড্রাগ এটা? অ্যান্টি-নিওপ্লাস্টিক ড্রাগ, অ্যান্টি ক্যান্সার ড্রাগ। দেন ডিগক্সিন used in heart failure. ঠিক আছে? Lignocaine. What is lignocaine? It's an antiarrhythmic. The monitoring is done for antiarrhythmic effect, not for the local anesthetic effect. ঠিক আছে? Quinidine is also an antiarrhythmic. So these are the candidate of drug used for therapeutic drug monitoring. So outcome, dose enhancement for efficacy and safety. ঠিক আছে? Then education, কি education হবে, কি education হবে? So you can know more about the pharmacokinetic and pharmacodynamic activity of the drug. Then research and development, ঠিক আছে? So what are the prerequisites? What are the requirements? Clinicians who can diagnose the disease. Then clinical pharmacologists, they are the one who are going to interpret the result and do the, then trained laboratory technician. So all the machineries that are there are run by these technicians. ঠিক আছে? Equipment, of course these procedure requires expensive equipment to run. বুঝতে? Reagents, of course various reagents are required for running the procedure. Now we come to limitations. Limitation কি কি আছে? So limited number of drugs are chosen for this procedure, not all drugs. What are the indications? সব ভুলে গেছে, ঠিক আছে? Scientific accuracy of drug assay. Now different drug assay gives different results, different concentration. They may vary from methodology to methodology, ঠিক আছে? Then limited access. So all these procedures require expensive equipment, highly sophisticated lab. It may not be possible to perform therapeutic drug monitoring everywhere. Then trained manpower. So all these HPLC, RIA, ELISA, they require trained manpower for performing the test as well as interpretation of result. Need coordination between good clinical practitioners, cannot compensate for wrong diagnosis. ঠিক আছে? If your diagnosis is wrong, P2DM cannot help. Poor choice of drug. So if you are giving a wrong drug for wrong therapy, it won't help by doing a therapeutic drug monitoring. Then error in dosage. There is error in dosage. Therapeutic drug monitoring cannot help. ঠিক আছে? Therapeutic drug monitoring comes as a short note. বুঝলি? দীপজিতা বল কি লিখবি? পেপারে এসছে থেরাপিউটিক ড্রাগ মনিটরিং। শুরু কর, শুরু কর, কি লিখবি? নো, হবে না, হবে না। এনিওয়ান বল, বল। হ্যাঁ বল, হ্যাঁ বলছি ইন্ডিকেশন গুলো বলবো। হ্যাঁ তারপর বল কিছু কিছু ইন্ডিকেশন বল। এরকম করে বললে হবে না। আদিত্য বল ইন্ডিকেশন বল। ইন্ডিকেশন তোর নাম কি? হ্যাঁ কি? বাটনি, বাদনি, বান্টি, বান্টি। হ্যাঁ বল বান্টি বল, তোকে প্রথমবার দেখলাম। হ্যাঁ বল ইন্ডিকেশনস। Indications, anyone? এই 5 মিনিট আগে পড়ালাম, কিছু বলতে হবে? হ্যাঁ, বিদিত কিছু বলতে চায় না, ওরকম করে বললে হবে না। লো সেফটি মার্জিন আর হ্যাঁ কি ভায়াবল এফেক্ট বলছিস? না, আর লো সেফটি মার্জিন একটা বলেছে, আর অ্যাডভার্স ড্রাগ ড্রাগ ইন্টারঅ্যাকশন, আর ফাইন্ডিং নো কজ অফ ফেলিয়ার অফ রেসপন্স, আর হ্যাঁ ঠিক আছে, তারপরে জেনে নেবে কেউ কিছু বলতে পারে। পেশেন্ট কমপ্লায়েন্স, আর ঠিক আছে ইন্ডিকেশন বললো, তারপর অনুরিক্তা না অন্তরিপা, হ্যাঁ অনুষা, হ্যাঁ তারপর প্রথমে লিমিটেশন, ড্রাগস ইউজ, গিভ সাম এক্সাম্পল, কি কি এক্সাম্পল কি কি আছে বল, বান্টি বলবে, বান্টি বলবে, লিথিয়াম, হ্যাঁ তারপর তুই বল, ফেনিটয়েন, তারপর তুই বল, না তুই বল, ডিগক্সিন, তুই বল, কার্বামাজিপিন, তুই বল, লিগনোকেন, তুই বল, ভ্যালপ্রোয়েট, অনুরিক্তা, অন্তরিপা, হ্যাঁ সাইক্লোস্পোরিন, অনুষা, হ্যাঁ না জেন্টামাইসিন, হ্যাঁ মিথোট্রেক্সেন, আর হ্যাঁ ইমিপ্রামিড, ভ্যালপ্রোয়েট বলে দিয়েছে এখানে একটু, ঠিক আছে। সো গিভ সাম এক্সাম্পলস, তারপর থিওফাইলিন করে, অনেকে করে, ঠিক আছে, আমি একদম না বলবো না, ভ্যালপ্রোয়েট বলেছে, ফিনোবারবিটান, হ্যাঁ এটা হয়ে গেল। তারপর নেক্সট পয়েন্ট কি হবে? হ্যাঁ হ্যাঁ আউটকাম হচ্ছে ডোজ মডিফিকেশন ফর দ্য বেনিফিট অফ পেশেন্ট অ্যান্ড, আর কি হতে পারে? ডোজ মডিফিকেশন তো একটা হলো, আর হ্যাঁ হ্যাঁ প্রসিজিয়ার, না ডোজ মডিফিকেশন একটা আউটকাম হলো, ঠিক আছে, আর ইফ দেয়ার ইজ not used it, if doses are exceeding the you can predict the adverse effect, alright, আর প্রসিডিওর কিছু প্রসিডিওরের নাম বল, মান্টি কিছু প্রসিডিওরের নাম বল, এলাইজা, আর দীপজিতা কিছু প্রসিডিওরের নাম বল, HPLC তুই বল, এলাইজা তো বলে দিয়েছে, রিয়া, ঠিক আছে, তারপর নেক্সট পয়েন্ট, হ্যাঁ HPLC বলে দিয়েছে, হ্যাঁ বলে দিয়েছে। আচ্ছা নেক্সট পয়েন্ট কি হবে প্রসিডিওরের পর? রিকোয়ারমেন্ট দিলেও চলে, না দিলেও চলে, হ্যাঁ তারপর লিমিটেশনস, ঠিক আছে,